Hi, everybody. Gary, thank you so much for joining us. Poor Gary, I bumped into him on the plane yesterday and dragged him in. He's at a plastic surgery convention, and now he's with us. Thanks for coming, Gary.
Thank you, and don't believe a word of that. This is all planned in advance. No.
I don't believe a word he says. Gary and I were speaking on the plane about the innovations in plastic surgery and how it affects estheticians and massage and everything that goes on in the salon world. Gary, I want to know from you for estheticians who are doing massages, if they have a client who recently had liposuction, is that an issue?
Not really. With liposuction, it's very difficult to mess anything up. And that's the nice thing about liposuction. People can get back to their activities real quickly. It's things that involve the face and the eyelids. When people have surgery in those areas, you have to be kind of careful.
You mean the laser treatments and dermabrasion? Fill us in.
Yeah, all of that. So getting back to the liposuction, which was your question, massage is one of the best things, and that can be started soon after all the bruising settles down and people don't have any more discomfort. The incisions are very small, so you're not going to disrupt any incision. It's not going to come apart. But certainly with laser resurfacing of the face, any microdermabrasion, you have to be very careful, especially when someone's had surgery on the face, because you can do serious damage, and that's why we tell people to talk to their surgeon before going to any esthetician or spa.
What is the minimum amount of time a client should wait or a patient should wait before he or she goes to get a facial?
It depends exactly what's being done. Now, certainly in the first week after surgery, we encourage them to use moisturizer, to use sunscreen. They can shampoo after a couple of days, and this is where an esthetician can be, or a salon can be very helpful, because after facelift, people have a lot of, a little blood in their hair, and it can help a lot in helping the scars early on after the drains come out. But as far as anything that might involve a peel, I usually tell people to wait about 3 or 4 weeks.
For patients who have had facelifts, how about getting haircut, going to the shampoo bowl?
Shampoo is great after about 48 hours. It's coloring that you'd really want to wait about 4 to 6 weeks. You ladies would know better than I would as far as the stress on on the circulation to hair follicles. And hair can really take a beating, especially when someone's had a brow lift or the incisions that go into the hairline. So that's something you want to wait for coloring about 6 weeks.
Many of us cannot wait 6 weeks for color, Gary. What do you suggest for us?
Well, in the first 6 weeks, you're going to be loving your new face so much that you're not going to be interested in your hair.
Want to bet? You're here in the salon world. We do care about our hair. How about, do you know anything about the Brazilian treatments or any of the straightening treatments?
Not in the least.
Thank you. How about a lot of salons carry their own skincare lines. Are there any special ingredients that should be in these lines, special ingredients that we should be looking out for and be looking out for?
Nothing that's really detrimental. I mean, there's things that help the skin a lot, things with antioxidant properties, vitamin C, and there's so many. Again, I'm talking to the pros here as far as things that are helpful. But obviously, after a facelift, there's nothing that's too irritating on the skin. So anything that may have any acid in it, you want to hold off for about a month or so before using that on a facelift patient.
Okay, now for hairdressers and salon owners as patients of yours, when I spoke with Gary earlier, he said very few people are actually having facelifts, that they're doing a lot of the liquids and the injections, which Gary and I have been talking. I may be visiting him in a little bit. Tell us more about that, the innovations and how wonderful they are.
Well, the fillers in Botox are clearly the most important things we do, because that keeps people coming back. So someone may have a facelift when they're in their 50s or 60s, but you can start these fillers very young. So Botox has been around for about 10 years, and now it has a competitor called Dysport. It lasts about 6 months, and it's fantastic for dealing with the wrinkles of the upper part of the face. The lower part of the face, we use fillers, and the most common one would be something with hyaluronic acid in it. And the common ones would be Restylane and Juvederm. And they also last about 6 months.
I appreciate you not using all the big words. That's great for us. So I know there were several people in the audience that wanted to ask Gary some questions. Excuse me, Dr. Smotrich. Anybody have anything in particular? We're going to repeat the question. Okay, the question from the audience is about the lines in the neck. Gary, tell us what we can do for those.
You could do a light peel on the neck. There are some people that do laser resurfacing on the neck, but you have to be very careful. The skin is thin, and if you have any scarring, it can be disastrous in the neck area. But certainly we peel down to the cleavage area with good results. So the fine lines on the neck, you have to be very careful. There are obviously people who don't do surgery on the neck because they're much more cavalier about it, but you can have disastrous results. So scarring is the thing that we fear.
The question is, do you prefer chemical or laser for the neck area?
I usually use chemicals. The laser, again, some of the lasers, they're very low intensity, so they don't do a whole lot, but it's still the gold standard. When people have a lot of wrinkles, deep laser resurfacing is still the best. There's a lot of recovery with that.
Yes? Okay, this is for the patient who has had breast augmentation. She wants to go to the spa and have a massage.
Well, chances are someone's already done the massage in the home setting, but you would. It's uncomfortable. Things are uncomfortable for a few weeks, but after that, it's safe. Right. If it's safe enough for a mammogram, it's safe enough for a massage.
Yeah, we don't like those mammograms. Those things hurt.
Right.
Anybody else? I saw some other questions. Yes? Okay. Hereditary dark circles. Gary?
Well, every Sunday in the New York Times, I see these ads for a lot of products, and you'd know better than I would how they work. As far as surgery, nothing works. And generally, the lasers that we have don't work well either. And something like intense pulse light can help with brown spots, but this is a collection of blood, and it's just pigmentation that's been built up over the years. And a lot of times we tell people, cover up makeup is the best thing. Now, I have no idea, again, how the products work, but you probably have a lot on the floor here.
And what about the brown spots?
The brown spots do respond well to lasers, and it is something simple called IPL, or intense pulse light. So we have a lot of ways to treat that.
Anybody else? Anybody want a boob job out there? We're all going to be lining up. Gary is the president of the New Jersey... I'm going to have Gary tell his title.
We're jumping the gun by 3 weeks, but incoming president of the New Jersey Society of Plastic Surgeons, representing about 150 plastic surgeons in New Jersey.
And you also have your own Lawrenceville Plastic Surgery outside of Princeton, New Jersey.
Right. In central New Jersey.
Central New Jersey, and there we are. That's that Jersey thing again. We just can't get away from it. Which brings me to something very special. We have been so dissed on a regular basis with Jersey Licious, the Jersey Shore, the Real Housewives, and that's my town. I'm really irked by that. As a plastic surgeon, what would you say we can do to make ourselves look a little higher end?
Well, I wouldn't change a thing because Jersey Shore premiered since last summer. And in New Jersey, you have to look good for the beach. So I think it's the best thing for our practices.
Have you had more clients or patients as a result?
Absolutely. Breast augmentation business is way up.
How about these clients who are tanorexics? Are you helping them one way or the other?
Well, we don't discourage tanning only to the extent that it can lead to skin cancer. Now, the interesting thing is that the federal government was proposing a tax on cosmetic surgery, and they changed it to a tax on tanning. So our gain is the tanning salon's loss. But let's face it, you walk around in the summer and you're pale, you look like you're ill. So there's no way of really telling people not to tan. But you have to be careful like anything else.
You okay with spray tanning?
A little bit out of my league, but I don't think it causes any harm.
Because I'm a paleorexic. We have a question back here? No? What's the most common surgery in general in the U.S., and then what's the most common surgery in your practice?
Excellent. The most common surgery is still liposuction, and things have changed a lot with that. There's a lot of technology now that uses lasers to help the skin shrink, but in my practice, it's breast augmentation. So the thing that's really dropped off the charts is facelifting. It's expensive, it's a lot of downtime, and it's tough to convince people to have a facelift when there's so many things like fillers and Botox that can do the job. It's definitely not a substitute for a facelift, but they do a great job in staving off surgery.
Another question? The question is, have you seen the age range go lower and lower in his practice?
Not a whole lot. I think with breast augmentation, there's certainly people in their teens who want it, but the federal government has set guidelines that you can't do breast augmentation under the age of 18, and if you're using silicone gel implants, you have to be 22. Now, on the West Coast, there are people in their 30s and 40s having facelifts, but in central New Jersey, people really hold off until their 50s and 60s. But it really spans the age bracket. Certainly people who are older, having kids at an older age, they're having their tummy tucks and breast lifts at an older age now.
No, I was just going to ask, what is the single most horrible thing we're doing to ourselves that requires facelifts or rejuviderms and fillers?
Most of what is happening with someone's face and aging is not anything you're doing consciously. It's simply the aging process and genetics. There are people who simply have excellent skin, depending on someone's ethnicity, so you can be 60 and not have a wrinkle on your face. People from Northern Europe, for instance, wrinkle more, and they'd be more inclined to need something. And obviously, smoking can be disastrous, and people in their 30s can look like they're 60. So that's probably the single biggest thing, and obviously sun damage.
Brow lifts, that's a very important question. Brow lift, Gary, that's what we were talking about.
Well, a brow lift is a procedure that's not considered a lot, and it should be. Oftentimes people have eyelid surgery when the real problem was their brow. Now, years ago, the standard incision was going across the top of the scalp. It was a fairly big incision. Then people went to endoscopic techniques, which is a lot of small incisions, but the results were not long-lasting, and it was a very artificial lift, where the central brow was lifted up. So people are going back to that incision across the top of the head. Now, the problem is if someone doesn't have a good hairline or thick hair, it can be a problem. And obviously in a man with a receding hairline, you wouldn't want to do it.
Is that considered a facelift?
Oh, no, that's separate. No, it's often done with a facelift and eyelid surgery, but it'd be separate.
Any other questions? Oh, two more questions, and then we have to let Gary go because he wanted to go shopping. Women considering surgery, what are the top three things to consider before committing to the surgery?
Well, I'll say there's really two things. Who's doing the surgery and where is it being done? Now, the problem with a lot of procedures, they're not done by plastic surgeons. It depends on the state and the licensing. But a lot of plastic surgery is not done by board-certified plastic surgeons. Now, depending on the procedure, eyelid surgery may be done by an ophthalmologist, and they'll do it well. Rhinoplasty, nose surgery, may be done by an ear, nose, and throat surgeon. But what we're seeing nowadays are people who aren't even surgeons doing liposuction, doing things that have a lot of risk to them. So you want to look at someone's credentials, and the most important thing is to make sure they're able to do something in a hospital in addition to their office. And most cosmetic surgery is now done in people's offices. So you want to check their credentials. The other thing is you want to see where surgery is being done. Like I was talking about office-based surgery, you want to make sure it's accredited, and you want to know who's giving your anesthesia, because there have been a lot of disasters of late. There was a woman who died having liposuction. It was in a spa in Western Florida in the last 6 months. So you have to be very careful about the setting of the surgery. This was being done by an internist doing liposuction. Again, there was nothing illegal about it, but you can run into problems. And those are two most important things.
I'll add a third. Check your insurance, because sometimes the insurance covers the physician but does not cover the facility.
Actually, and one more thing. When we sit down for a consultation, we always show people our results, and usually they're our best results. We should always ask the surgeon to talk to some patients. You don't have to identify yourself by name, but every surgeon has people in their practice who are more than willing to talk about their surgery, to talk to someone who's had the same operation. And that goes a long way to finding something about the post-operative course and how easy the surgery was.
Any way to find out if they're bad? I mean, can you go online? Are there sites other than awfulplasticsurgery.com, which is a great site? It's so much fun.
There are loads of sites, and actually we were talking in our plastic surgery meeting today about some people who've really been badmouthed and the legal recourse, and there's not much because it's the First Amendment. So there are all too many sites now talking about bad results. So it's important to pick one's patients wisely and hopefully not have bad results.
One last question. Someone was, she got taken away. Anything else? Anybody want to know? Dr. Gary Smotrich, we are so honored to have you come and join us, and thank you so much for coming to Modern Salon TV. It's such a pleasure to have you here, and next time we're going skiing. We're going back to Aspen. That's where we met. So 30 years ago-ish, 30, 28, whatever, a long time ago. 80. Now he said 80 years ago. Thanks, Gary. Thank you for coming.
My pleasure. Thanks, Maggie.